guys, I thought I'd make a video on talking about Fowler syndrome. Fowler syndrome is something I've had for the last 15 years. It's the inability to pass urine because the urethral sphincter muscle goes into spasm, and it basically means you just can't pee anymore. It also causes a lot of bladder pain, bladder spasms. You get a lot of UTIs, which is urine infections. You spend a lot of time in and out of hospital on antibiotics and all of the, what's the word I'm looking for, complications, all the complications that you get from being in and out of hospital. You'll pick up like MRSA or sort of resistant bugs, or you know, if you're anything like me, you're absolutely impossible to cannulate now. You can't get a needle in your arm with Enflon because your veins are all to pot, so it means you have to have a central line put in, or you have to have a PICC line put in, and you know, I'm resistant to every single antibiotic going now, so if I do get an infection, then it's pretty dangerous, you know. So basically, yeah, Fowler syndrome. I woke up one morning and I couldn't pass urine, so 2 days later, eventually I was absolutely bursting for the toilet. My bladder was so full, I went to A&E, where they catheterised me, so they put a catheter into my bladder. So they do that, like for any of you who don't know, through your urethra into your bladder, and basically emptied my bladder for me. So I was sent home for a couple of days with a catheter in and on free drainage. You know, the one thing I don't have is any night bags or leg bags, because I'm kind of on to the next stage. I don't need all that now. So yeah, I was sent home. A week later I went back to clinic. They took the catheter out, and it was called TWAC, trial without catheter. I was able to pass urine, so I was fine for a couple of weeks after that, and then it just kind of ongoing, on and off, so I was in and out of hospital quite a lot, you know, catheterised quite a lot, infections quite a lot, so then they decided they were going to teach me how to self-catheterise. So it's passing a little catheter, which I've got here, I'll show you in a minute, into your bladder by yourself. Now, the thought of that absolutely horrified me. I was like, I'm not doing that, there's no way I'm doing that, I'm not going to let anyone else do that to me. The fact that they bring you a mirror and they sit it between your legs, and there's a nurse poking about your bits down there trying to tell you what the right part to put it in, and then she wants to watch you doing it. No, that just wasn't happening. Couldn't accept it, wouldn't accept it. It took me a long time to get my head around the whole process of being able to do that and actually wanting to do that. Again, the downside of that is you're going to have lots of urine infections because you're actually passing a foreign object into your bladder, no matter how clean, you know, like you wash your hands, or, you know, it's just going to happen. So again, you know, in and out of hospital quite a lot, and this is before I had a diagnosis of Fowler syndrome. You know, they just said it was all in my head, there was nothing wrong with me. They were pretty nasty to me all the time, and you know, eventually, you know, I asked for a second opinion, and I got sent down to London, where I met Professor Fowler herself. It's her diagnosis. She diagnosed Fowler's, obviously, I named after her. And you know, she did an EMG test. It's a bit like, you can hear sort of like whales and helicopters. It means the pressure in the urethral sphincter muscle is very high. So I was diagnosed with Fowler syndrome, and I was given a sacral nerve stimulator, neurostimulator. I had many goes at the stimulator. It didn't work for me, you know, it kept moving, and you know, it's like, you know, I'll in my next video I'll go into details on what the neurostimulator is. You know, maybe there's people out there who are thinking maybe they do have Fowler's, you know, and they move on to the next stage, so I'm not going to kind of jump and ramble through everything now. So I will talk about the neurostimulator in a later video, and then I'll talk about the next stage where I am at. You know, I went from basically being diagnosed with Fowler syndrome to having a suprapubic catheters, you know, where they insert that through your skin, usually on the pubic bone. It goes straight into your bladder, and you have a catheter hanging out there basically. You can have it on free drainage, which means you can have it attached to a bag, or it can either go around your belly, or it can be like a leg bag that attaches around your leg. Or at night time you can have a night bag, which is bigger, it holds more. Or like me, if you have quite a good bladder capacity, then you can have a thing called a flip flow valve, Now this is a flip flow valve. Now I open it up. I put one of these on the end of my catheters. So basically what happens is, I'll show you just now. Okay, so this is a catheter that would be in either your urethra, or it'll be through your belly into your bladder. So this end sits in your bladder and this end is hanging out. Now I've already got a flip flow valve on, which is just one of these, so you just put it in. When you need to pee, you just open the sprout, urine comes out. When you've finished, shut the lid off again, give it a little shake like a man, and your catheter just sort of hangs kind of like this. Some people like to tape it to their belly, so you would tape it. I like to tuck mine in because it does move, it causes a lot of friction inside your bladder. The end of this catheter does rub on the bladder wall, and this balloon would be inflated to keep it in your bladder. It causes a lot of trauma and debris, so you will get a lot of debris in your bladder. So then you need to learn to really do washouts, which is a whole new concept. I'll maybe do that in another video where you have a big 50ml syringe or little bags and stuff. Again, I'm not going to bombard you with too much on my first video. So that's the concept of suprapubic and having a urethral catheter, and most of them look like these. Some are see-through and clear. Depends kind of if you've got like a latex allergy, or some of them have silver nitrate in them, which kind of is to stop the area around your tummy where the catheter sits in, to stop that, basically, what's the word I'm looking for? I can't remember, but anyway, it's to stop it kind of disintegrating is the word I want to use, but it's not. I can't remember the right word, sorry. But you know what I mean, to kind of stop it breaking down. So when they teach you to self-catheterize, as I say, they sit this mirror in between your legs, and you have to kind of find your urethra. And it takes quite a while to suss it out and to learn how to do it. And there's all sorts of different types of catheters that would suit you. You have to kind of decide. So what I did when I used to self-catheterize, because I don't actually do it anymore, because I have a thing called a mitrophanol now. So again, I'll go into that in later detail and I'll show you kind of what I do with my mitrophanol. But anyway, this is called a SpeediCath compact catheter, and women can carry these around in their handbag. And when you need to catheterize yourself, you just twist these, you open it up, and then you push it out, and basically this is how you self-catheterize. I can't even get the lid off. That's it. So that's it there. This is a catheter. So you would pop this, it's lubricated, it comes like kind of water, there's water in there, so you pop that in your urethra, urine comes out here, that's it. Slide it back in there, and then you just discard that and put that in the bin. So these are little handy sizes for your handbag if you don't want to carry a big catheter about. These can be quite tricky and fiddly to use, and I would say only for experienced people who can ISC and have been doing it for a while probably use these, because as you can see it's quite short. Now your women's urethra is quite short anyway, but these take kind of practice. And the other catheter I have that I use are these. SpeediCath Compact. Now this is a male size, and the reason I have male sizes is because of my mitrophanol stoma, and I use male sizes. Female catheters are probably about this big. It's exactly the same concept. When you open it up, if I can get it open. So there's water inside your lubricant, so you just be careful you don't tip the water out. And again, this is a catheter, and it's quite slidey, it's quite slimy. Again, you would just put that in to the urethra, it would empty. When you're finished, you just take it out, and then you just discard this, you just put it back in the packet. Oh, hit myself in the face. And then you can put it away. These are quite good, but I don't use these for my mitrophanol stoma because I find they're like gritty and they hurt the actual stoma tract. So what I do is I use these ones. Now these are quite new ones. So these are called VapePro intermittent catheters, and these are non-touch ones. So like I showed you before, with the other ones well, what you do with this one, you don't actually need to touch it. With all the other ones, you hold them in your hands. Now obviously you make sure your hands are clean before you wash your hands and stuff, you self-catheterize and then empty it. But these ones, these are non-touch. So what happens is you just tear it all the way down, so the packet opens. And again, remember, I have male length ones because it suits my tract. Whatever suits you better. Now, I don't know if you can see this, okay? That's the end that the urine will come out, but it's in a kind of bag, a see-through bag. Can you see that? So what you do is you would pull the lid off, like so. You can see the water coming everywhere. Okay, and now this little tract for me, this sits in my mitrophanol stoma, which I will show you, and then you just feed the catheter through, and it goes through the tract, and again, you're not touching the actual catheter, so this is sterile, because you can see this little bag. These have caused me to have much less infections than I normally would have, and yeah, these are so great. So what I will do is I'll stop the video and I'll restart it, and I'll show you me actually using my mitrophanol stoma. For a lot of you with Fowler syndrome, if the neurostimulator doesn't work for you and you can't cope with a suprapubic catheter, like I couldn't cope with it, most people with Fowlers don't cope with it, then definitely a mitrophanol is the way forward for you. Now, it's not without its hassles. I have been pretty ill with it. I've had a lot of problems with it, but I'll show you how it works, and then at least you have a kind of insight, because I wish I had seen one of these working before I got it done. So hang on and I'll show you how it works in a minute.